So tell me a little bit about what impact PEPFAR has made in Uganda since the program was first created in 2003, and what would the implications of not having that kind of response have been in places like Uganda?
Well, PEPFAR saved millions of lives in Africa, and in Uganda we got 170,000 people who would not have lived, but they are alive today because of PEPFAR. It has changed the picture of families and changed the situation from that of despair to hope, because people got treatment, the death rates have decreased, and the program itself has been able to improve on infrastructure. It has been able to train many healthcare providers and provided other benefits besides AIDS. So this has been one of the most successful U.S. foreign aid programs in recent history.
Well, if PEPFAR had not been created, what would have happened?
Well, it came at a time of utter catastrophe. Hospitals were clogged with patients. They had ceased to function. The floors, the beds within wards were full of AIDS patients. Healthcare providers were dying, and all of these would have escalated. It would have been mayhem without PEPFAR.
You've been expressing concerns recently about flat funding in PEPFAR's budget. Can you tell me what you're seeing on the ground in Uganda in your clinic?
Well, flat funding has begun to reverse these wonderful achievements of PEPFAR. We have begun to see patients being turned away from clinics. They go over there to seek treatment, and they are turned away because there is no treatment for them. We have seen a group of people who are moving from clinic to clinic. All of these are threatening to reverse the wonderful achievements of PEPFAR.
Have you yourself had to turn patients away?
Yes, we have been turning patients away because we have no new money to treat patients. And this includes pregnant women who are HIV positive, and that has very serious implications.
Can you tell me a little bit about, we've heard reports about stockouts and people either stopping their drugs or sharing drugs. Can you talk a little bit about what you've seen firsthand on that front?
Well, I have seen the patients taking drugs, and yet their family members are not able to access treatment. Specific examples include a woman who was taking treatment, but when her family member, her daughter, needed treatment, she couldn't access it. And in this case, it's insufferable for a mother herself to be saving her own life when the life of her child is in danger, is in critical danger. What we have observed in such situations is that the mother either shares treatment with her daughter, or, as happened in some cases, the woman just returns the drugs and says, look, I cannot stand this situation where I look like I'm trying to save my skin when the rest of my family is dying around me.
So she gives up her drugs?
So she gives up her drugs.
What are the long-term implications of sharing drugs?
Well, the long-term implication is that shared drugs are not going to work for either of the two people sharing out the drugs, two or more people sharing out the drugs. On the contrary, underdosage, which they are receiving, is going to result in resistant virus. And if you get this resistant virus on a wide scale, it threatens the public sector treatment of AIDS. We fear, and we are very anxious that public sector resistance does not arise, because that would mean having to test patients with highly expensive resistance tests before we start them on treatment.
So what will happen if flat funding continues, if this becomes the new reality?
Well, we hope it doesn't become a new reality because the consequences are too catastrophic to contemplate. First of all, we are going to have increasing number of people not on treatment. We are going to have the few people on treatment having increased sharing out of drugs and misuse of drugs. We are going to have people beginning to die in very big numbers because they are not getting treatment. We are going to go back to the 1990 situation where all our hospitals were overwhelmed with dying patients due to AIDS. So we hope this situation doesn't happen. We need to act now so that the situation is not allowed to happen.